Hello, Dr. Blake. My name is Azala Buddah-Williams. That is AZALIABUDDAH-WILLIAMS. I'm going to be completing a 360 scan of the room to show there's no posted material. Only the patient and the videographer is present. So based on the patient vital signs interpretation, the heart rate is 105, which is elevated. The blood pressure is 167/100, which is also elevated. The temperature is 37, which is normal. And the respiration is 20, which is also normal. Based on these findings, it would indicate that the patient is having unstable angina or an MI. I would notify the NP or MD to further assess and to recommend a beta blocker. Now I'm going to move on to inspection of the cardiac. So based on the patient appearance, the patient appears fatigued. However, there is no diaphoresis or no increased work of breathing. There is no pallor or cyanosis, no jugular vein distension, and there is no visible pulsation, lifts or heaves. The patient appears normal and is able to speak in full sentences. Now I'm going to move on to palpation of the pulses. So I'm going to palpate the carotid pulse one at a time, the brachial pulse, radial pulse, capillary refill less than 3 seconds, which is normal, dorsalis pedis pulse, capillary refill less than 3 seconds, normal. I'm going to perform hand hygiene. So what I found on these was that the rate of 105, 2 plus regular rate equals strength and normal. So now I'm going to move on to auscultation. So I'm going to auscultate for any S1 and S2 sounds using the diaphragm of the stethoscope. So I'm going to locate the sternal notch. I'm going to move down to the second right intercostal space. This is the aortic valve area, and S2 is heard loudest. Moving across to the second left intercostal space, left sternal border. This is the pulmonic valve area. S2 is heard loudest. Down to the third left intercostal space, left sternal border. This is the Erb's point, and S1 and S2 is heard loudest. Down to the fourth intercostal space, left sternal border. This is the tricuspid valve area, and S1 is heard loudest. Down to the fifth intercostal space, mid-clavicular, and this is the mitral valve area, and S1 is heard loudest. Now I'm going to listen for any extra hard sounds, and extra hard sounds would be S3 or S4, or any murmurs, which would be a quiet blowing swishing sound. So I'm going to go in the same landmarks: aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And no extra hard sounds was heard, and no S3 or S4. I'm going to use the diaphragm of the stethoscope to locate the apical pulse, and I'm going to listen at the mitral valve area. This is the fifth left intercostal space, mid-clavicular, and I'm going to listen for a full 60 seconds. So the rate was 105, regular rate and rhythm. No murmurs, no S3, or no extra hard sounds heard. Now I'm going to move on to inspection of the GI. So can you lay down for me, please? So I'm going to look at the abdomen. So based on the appearance of the abdomen, there is no bruising, jaundice. There is no rashes, scar, lesions, or striae. The abdomen appears symmetric. The umbilicus is midline. The contour is normal, and there's no visible distension. So I'm going to move on to auscultating the abdomen. I'm going to move in a clockwise manner using the diaphragm of the stethoscope, and I'm going to start at the right lower quadrant. So in the right lower quadrant, I'm listening. I heard this is the appendix area is found here. The right upper quadrant, the liver and the gallbladder is found here. And the left upper quadrant, the stomach and spleen is found here. And the left lower quadrant, the gallbladder, the descending colon is found here. So what I heard was normal active bowel sounds in all 4 quadrants between 5 to 15 seconds. So now I'm going to move on to percussion. I'm going to start in the right lower quadrant, moving in a clockwise manner furthest away from the pain. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So what I heard was tympani over airfill space and dullness over solid organs. Now I'm going to move on to palpate. I'm going to use 3 to 4 fingers, and I'm going to palpate in a circular motion. If you have any pain, let me know. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So what I felt was tenderness over the epigastric area and rigidity. So now I'm going to move on to the S-bar. So, hello doctor, my name is Azalea Buddah-Williams. I'm calling in regards to patient in 201, a 63-year-old female with constant epigastric pain and 8 out of 10. Pain began around 8 o'clock this morning after breakfast. Pain has been constant. Sometimes it radiates down to the arm. The patient has a spicy food intolerance, vomiting, and a chest pain of 5 out of 10. I auscultated. Based on the assessment, I found the heart rate is regular, blood pressure 167, heart rate was 105. The patient appears fatigued. Cardiac assessment, GI epigastric tenderness was present, normal active bowel sounds. Based on these findings, I would request immediate MD or NP to evaluate and to continue monitor. Critical thinking, based on the patient appearance, I would suggest the patient may be having MI or unstable angina given the history, and I would, 2 nursing interventions would be to continuous cardiac monitor, to repeat vital signs, to detect changes, and to prepare for urgent medication and blood work. 2 physician order would be a 12-lead ECG and troponin. This is the end. Thank you.